Well, if you've been told that you have depression, but nothing has worked for you, our next guest may have some help. So Dr. Holly Agud, a psychiatrist at Baptist Health in North Little Rock, joins us to explain a treatment that is used when other depression treatments haven't been so effective. Thank you so much for joining us today.
Thank you for having me.
Of course, we are talking about transcranial magnetic stimulation, or TMS.
Yes.
Explain, what is this?
So TMS, or Transcranial Magnetic Stimulation, is a safe, effective, and non-invasive form of brain stimulation that uses electromagnetic pulses to treat depression. It is effective and really simple to do.
Who would be the right candidate for TMS?
So it's FDA approved for patients who have severe major depressive disorder who either aren't responding to medications or therapy alone, or who just aren't tolerating the medications. But similar to medicines, not everybody is appropriate or responds to TMS.
What does a typical treatment look like?
Sure, so it takes less than an hour. You do it in a doctor's office 5 days a week for 4 to 6 weeks. Patient sits in a comfortable chair. Because we use electromagnetic pulses, similar to MRI machine, but much weaker. You can't wear any magnetic sensitive things like jewelry or credit cards. So you'll sit in a chair, they'll have a magnetic coil placed on their head. They might hear a clicking sound or feel a tapping sensation, but they're awake and alert the whole time. They can talk to a clinician at any time during the treatment, and then afterwards they can go right back to their daily activities.
Why does this work?
So it targets an area of the brain called the prefrontal cortex that is responsible for mood. And we know in patients with depression, this area of the brain is underactive. So the magnetic pulses basically stimulate those neurons and restore function to that area of the brain, which relieves symptoms of depression.
So I have actually heard of ECT, or electroconvulsive therapy. Is this similar, or is it totally different?
It is totally different. So electroconvulsive therapy used to be called shock therapy, purposefully induces a seizure. And because of that, we have to put patients to sleep with anesthesia and paralyze their muscles with muscle relaxers. Because of that, there's a longer recovery period. They have to be monitored for an hour or so after treatment. TMS, on the other hand, does not induce a seizure. You're completely awake and alert, and you go right back to normal activity afterwards.
So I'm guessing you don't have to be hospitalized then to receive TMS.
Right, it's all done in the doctor's office.
What are some of those side effects that can take place?
So it's really safe and tolerated pretty well. The most common side effect we see in about half of patients is a mild headache, easily treated with over-the-counter medications. We also can see in about a third of patients, they'll say that they have facial twitching or like a painful scalp sensation, but that's only during the treatment. If it's too uncomfortable, we can manage the settings on the machine a little bit or move the coil to reduce discomfort. The most serious side effect we can see is seizures. They're exceedingly rare, though. So in patients who are not prone to seizures at all, it's like less than 0.5% that would have a problem with it.
When would be a time for someone not to get TMS therapy?
So anybody who has a permanent metal implant, like in or around their head, like a cochlear implant, that wouldn't be appropriate. Or if somebody's prone to seizures, has had brain surgery or a traumatic brain injury or a pacemaker. Although some of these patients may still get TMS, it would just be case by case at the discretion of a physician.
Well, if somebody's interested in learning more, how should they reach out to y'all?
So they can call our clinic. We're doing TMS at our Baptist Health North Little Rock clinic.
Perfect. Dr. Agud, thank you so much.
Thank you so much for having me.